What happens when a serious injury or death occurs at a nursing home? One of the most important safeguards is the state's ability to conduct an investigation. This is called a complaint survey. In this video, we'll talk about what a complaint survey is, how it is initiated, what happens during the survey, and what happens after the fact as well. Now, the example we're using today is fictional, created solely for educational purposes, but it represents situations that can and do occur at nursing homes across the country. So, meet our resident at issue here. And since resident names are not used in surveys, we'll just refer to her as Resident 7. Now, here's what we know about Resident 7. She's been at the facility for about 2 years, and during this time, she has experienced something called dysphagia, which is a difficulty in swallowing. And in their assessments, the nursing home employees have determined that it is no longer safe for her to eat solid foods. And by that, we're talking about things like peanuts or tough meats like pork chops and a variety of other types of foods. So instead, they put her on a diet of softer foods, so there's less chance of her choking. And then they put this information in Resident 7's care plan. Now, each resident's care plan should outline the type of diet that the resident is on so that all the employees know and so that they can keep her safe, even when she's in the dining room eating. So that's the setup. Now, here's where things go wrong. One day, Resident 7 goes to the dining room at the nursing home to eat dinner, but instead of a diet of soft foods, she is given a meal with cut up pork chops. None of the employees catch the mistake, and Resident 7 starts eating her food. And she starts eating the pork chops, but she's not physically able to do so safely, and at some point, she starts choking. And she is soon unresponsive. In the next few moments, this becomes a life or death emergency. And staff members rush to her aid and perform the Heimlich maneuver on her. However, sadly, it's too late, and Resident 7 ends up dying. It's a sad situation, but it's not just an unfortunate accident. It appears something went really wrong at the nursing home that caused Resident 7 to be given food that was not safe for her to eat. So one of her daughters calls the state hotline, and she reports this event to the state agency that oversees nursing homes. I need to make this part really crystal clear. Anyone can report an event to the state. It doesn't have to be a family member. It can be a nursing home employee. It can be a visitor who saw what happened, or another resident, or even somebody who just calls in and reports the event anonymously. Regardless of who calls, when the state gets the call, they prioritize it to determine how quickly they need to get an inspector out to the facility. For cases they deem to be immediate jeopardy, which are life-threatening situations, they try to get a surveyor on site within 2 working days, if not sooner. If the case is deemed as an actual harm case, which means a significant injury or harm has occurred, state inspectors are typically there on site within 10 working days, again, if not sooner. Now, for cases where something went wrong, but it is deemed that no actual harm happened, although the potential for harm is there, these are typically investigated within 10 to 30 working days. Again, hopefully sooner if they can get there. However the harm is rated by the state, eventually a state inspector is going to show up at the nursing home to investigate the event. Now, for a complaint investigation, state inspectors will focus on the complaint at hand, but they may go into the facility and ask to see maybe 5 other resident charts so that the facility employees aren't for sure what resident incident is the one being investigated. In this focused investigation, they will look at several things. First, they'll review the medical records relevant to the complaint. They'll interview the specific resident involved, if that person is still alive and able to communicate. Now, of course, our Resident 7 is deceased in this example and obviously not able to be interviewed. They will also collect evidence specific to allegations, and the inspector may observe current care practices related to the area at issue in the event. And they'll also likely interview staff members who were involved in the incident, as well as administrative staff. Now, in our example of resident 7 choking, state inspectors will see the care plan that the facility prepared that identifies that she was on a pureed diet and should not have been given tough foods like pork chops to eat. And they will ask, why was resident 7 given pork chops with her meal when they knew that they weren't supposed to do that, when they were only supposed to get soft foods and not tough meats like pork chops? And during these discussions, they will have several specific regulatory rules in their minds. They will probably have at least these 2 rules in their mind. FTAG 656, the facility must provide each resident with meals that accommodate to the resident's needs. And FTAG 692, the facility must ensure that the resident environment remains as free of accident hazards as possible, and each resident receives adequate supervision and assistance devices to prevent accidents. Once the state inspectors have reached their conclusion that the facility violated some regulatory rules and resident 7's care plan, they will issue a citation against that facility. And at that point, they prepare a report, which we then call a survey. Now, that survey report is sent to the facility, and they're required to prepare what's called a plan of correction. It's also called a POC. The plan of correction requires the facility to explain, number 1, how are you going to fix this immediate problem? 2, what steps you're going to take to prevent it from happening again? And 3, how are you going to monitor compliance going forward? Now, that plan of correction is then returned to the state within a certain period of time. So look, there's obviously more that happens during a complaint survey, but our discussion here with our fictional event gives you a good idea of what happens during a complaint survey. Now, if you have a loved one who has suffered a serious injury or death at a nursing home, I recommend that you call the state agency that oversees nursing homes in your state and you file a complaint with them. In Missouri, you can file a complaint by calling the Missouri Department of Health and Senior Services at 800-392-0210. In Illinois, you can call Adult Protective Services at 800-252-2918, or you can go to the Illinois Department of Public Health Healthcare Facilities Complaint Portal. If you have found this video helpful, please let us know your thoughts in the comments. Our mission is to help people who have loved ones in nursing homes understand this industry, which can be daunting, confusing, overwhelming, and frustrating. So to that end, we'd appreciate it if you would like and share our videos so that they can reach more people. We sure do appreciate it. Thank you.